Those are options. Now, when a woman have protein in the urine as a pregnant woman, she is one of the women that you cannot discharge after 6 weeks. I know some women will discharge themselves. Once they deliver, you will not see them here again. I know 3 people here that once they carry their baby and go home, they will not even come back to the hospital. A woman has consistently have protein in her urine. After delivery, she comes back for 6 weeks. You will continue the urinalysis. You will keep on following her up until the protein in the urine eventually disappear. If it did not disappear, we might be dealing with what we call glomerular nephritis, which might be an early symptom of kidney disease. Kidney disease can manifest first time during pregnancy. Pregnancy can also make kidney disease to be worse. I don't know if you understand. Somebody might not have kidney disease and it manifests first ever time during pregnancy. Now, if the kidney disease was there before, pregnancy can make it worse. So if by commission or by omission we catch a patient who has protein in their urine, we should not just conclude that it is caused by pregnancy alone. We should follow her up to be sure that the pregnancy has not caused a kidney injury or that she has a previously existing kidney injury which has been made worse by pregnancy. So those are the things we actually look out for. If after 6 weeks that the proteinuria, that is protein in the urine, has disappeared, we follow it up, it has disappeared, we might just leave her. But it is a very big sin to discharge a patient who has protein in the urine solely because she has delivered. No. But if she has sugar in the urine and you do your fasting blood sugar and it is normal, you do it again, it's normal. You do HbA1c, it's normal. You are justified to leave her at that level. Unless if along the line she now delivers the baby and her baby is overweight, you want to investigate why is this baby overweight. But if there is protein in the urine, it is not the same thing like sugar in the urine, because that sugar in the urine most time does not have a tendency to cause another complication. Man, if you now see protein in the urine, you have to follow up that woman sometimes 2-3 months after delivery. Sometimes we follow them up for 6 months. Sometimes you have to go ahead to go and do a quantification. There is what we call albumin creatinine ratio. You have to go and do that one. Sometimes you have to go and check the amount 24 hours urine production to actually find out what actually is happening, because it might be a first sign that this person actually is having a kidney issue, or that the pregnancy has actually brought about a kidney problem, or that the kidney problem was there, the pregnancy now makes it worse. Also, a woman that had been having BP in pregnancy, she might have this pregnancy, she had BP. She had BP in about 3 different pregnancies. Sometimes you might advise her not to take in again, because each of those BP might have some injury. There are small injury on the kidney, and once that injury happens, it usually does not reverse back to the normal before the pregnancy. But in some women, and how do we find out? We find out by following them up with urinalysis. If we keep on following that up with urinalysis, we might come to a point that yes, there is almost a total recovery. We can now discharge her. But once we see a protein, you are no longer a candidate that our business will end in 6 weeks. Sometimes the business continues till 6 months. Man, a normal person without protein, with no BP, usually after delivery, whether it is CS, whether it is normal delivery, our business usually end after 6 weeks. In that case, we are expecting another baby. At least if you are coming again, you are coming to come and register for another antenatal. But you see the whole thing we can get from as simple as urinalysis. Is it clear? Another thing we can see in urinalysis is blood. But in the absence of protein, it has very little significance as long as the patient is pregnant. It's only when that person is postmenopausal we can say, let us check and see if she is developing a cancer. But on a normal, an issue once the woman is pregnant. That is for what? Urinalysis. As common as urinalysis. We can get so much information from it about the other test. But the other test is basically done once in pregnant, as the case may be, another.